I'm Huw Morris. I'm a neurologist and a neurogeneticist. I work at Queen Square and the Royal Free. So I spend about half my time doing clinical work and half of my time doing research. So our main research question is why people develop neurodegenerative diseases, so particularly Parkinson's disease and motor neuron disease. And there are two main approaches that we take to that. So one particularly big question, a big focus of research for us is why people might develop Parkinson's disease in their 20s or 30s. So Parkinson's disease is an age-related condition. So the average age of people developing Parkinson's disease is 68. So a lot of people develop Parkinson's disease in their 70s and 80s. It's thought of as an old person's condition. However, one thing that we've been really interested in is the fact that about 1% of Parkinson's patients develop their disease before the age of 40. So that's obviously a very rare thing to happen, to develop Parkinson's disease in your 20s or 30s, a very unusual thing to happen. And to my way of thinking, there must be a good reason for that to happen. So that means that those people must be exposed to some environmental factor or have some particular genetic factor that leads them to develop Parkinson's disease at a very early age. And so we hope we can understand why Parkinson's disease develops by studying these very special patients with early onset disease. So age of onset is very important to us, and we think that's a big clue as to why people have developed diseases and will help us to understand the disease as a whole. The other thing that we're particularly interested in is the situation where many people in a family have developed the disease. So usually things like motor neuron disease and Parkinson's disease are sporadic. That is, there are no other people in the family who've been affected. But occasionally we come across families where lots and lots of people in the family have been affected. So in that case, we think that there's a gene mutation, a spelling mistake in a gene that's running through the family, causing the disease. And by studying all of the affected people in the family, we can work out why the disease has happened in that family. We know that neurodegenerative diseases are becoming increasingly important for society. So those are conditions in which there's wearing down of nerve cells within the brain. So conditions like Alzheimer's disease, Parkinson's disease, motor neuron disease. These are progressive conditions that affect people later on in life. Patients with these conditions become very disabled. We don't have any, there are lots of things we can do to help people with these conditions, but we don't have any treatments that stop the disease in its tracks or reverse the problems that people get. So we know that for society there's an increasing burden in terms of social care, admission to nursing home, nursing care, admission to hospital, and notwithstanding the impact on patients and their families of being disabled by these conditions. So these conditions have a massive impact both on individuals, on families and on society more widely. What we hope is if we understand the cause of these conditions, then we can use these causes to develop new models for the disease. So those might be models in cells or in animals that we can use as a test bed for new treatments and therapies, and use that to develop new treatments for patients with these conditions. So that's the underlying aim of a lot of the research that I do. There is a more immediate and a more direct spin-off of the research, is that if you identify a spelling mistake in a gene that causes the disease, you can then offer that family a test to see whether they develop, whether they have that gene problem. Both people who are affected by the disease and also people who are not affected, so they can see what's going to happen to them in the future by having a gene test done. In fact, we know that in families that are affected by these conditions, running in families where lots and lots of people are affected, only about 10% of people at risk choose to have a test to see what the future holds for them in terms of having a predictive test for the condition. But that's really an immediate and direct spin-off of the research I do. I can sort of give an example of that by talking about a family that we studied with motor neuron disease and dementia. So this is when I was working in South Wales. So we studied a family in which we knew 10 people in the family had been affected by motor neuron disease. The disease affected them in the early 40s. They died about 2 years after they developed the condition. So it was a very rapidly progressive and severe form of the disease. We followed a lot of members of the family who were at risk of developing the disease. We studied their DNA through blood samples, their genetic makeup. We were able to show that the disease, the abnormality that caused the disease, was localised to chromosome 9, and they were then part of a collaboration to identify the gene mutation that caused the disease. For various reasons, it was very difficult to identify the gene mutation, and this work was really, my involvement in this work was really focused on one family that we were studying in South Wales, which you might think would not be a particularly important or notable thing to study. In fact, our collaboration identified the cause of the disease, which was a DNA expansion on chromosome 9, and it turns out this is the commonest cause of motor neuron disease in the world. So this affects about 6% of people with motor neuron disease and about 40% of people with motor neuron disease that have an inherited form of motor neuron disease. So this is the commonest cause of motor neuron disease in the world, and this is now available as an NHS test, so that patients with motor neuron disease can have a blood test to see if they carry this gene change. And perhaps equally important, there's been a huge amount of work on developing new treatments that are based on this, that will actually go back to the clinic and hopefully prevent this disease from developing and progressing in patients who have this disease. So that's really a family I was involved with, where we went from studying the family, studying the DNA, identifying the gene change, developing new tests, and hopefully going along the way to developing new treatments. I would say in our work in Parkinson's disease, we're not as far advanced in identifying new genes that cause Parkinson's disease. So what we have shown is that in patients with early onset Parkinson's disease, so people who have Parkinson's disease in their 20s or 30s, their parents are more likely to be closely related than in the general population. So their parents are more likely to be second, third, fourth cousins than patients in the general population. And what that means is that there's an increased chance of two spelling mistakes in a gene coming together. You have two copies of each gene, one from your mum, one from your dad, and if your parents are closely related, it means you're more likely to have two identical faulty copies of the gene, which is a type of genetic inheritance called autosomal recessive inheritance. So we've shown that this mechanism is likely to be important in early onset Parkinson's disease, and at the moment we're scanning through the genomes of hundreds and hundreds of patients with early onset Parkinson's disease to try and identify new genes which cause early onset disease. There are a few genes that have already been identified for early onset Parkinson's disease, and to date most of these genes cause a problem with mitochondria in nerve cells, so that's the energy production in nerve cells is particularly affected in some patients with early onset disease. My personal belief is that something like Parkinson's disease may have lots of different causes and different mechanisms, and the future of medicine will be actually targeting treatments to the specific causes of disease that people have. So if people have a problem with energy production in nerve cells, then they'll need specific treatments to treat that aspect of their disease. So we'll have a much more targeted approach to treating people with these conditions.